Hey, what's going on, bro? So we're going to be doing some cardio today, and asking questions. So let's. I just ate some food, and that's why I'm feeling a little bit like I was trying to do some work, but I just felt a little slow. So I'm like, okay, might as well get some work done. I would love to go work outside or walk outside, but it's still chilly nowadays. Like, it's still kind of cold. So I'm like, you know what? Like, F this. It's not worth walking outside right now. And I'm going to give it like a couple of weeks, and then I'll go outside again. So that'll be the goal. But right now, might as well get some exercise while I'm here. Get those steps in. I think last time I was doing this, we were doing this for a full hour. So, I mean, I think it works. Like, doing steps and going live at the same time, I honestly think it works. So I might as well do it. Day was good. Yeah, woke up at 11:30-ish. I think I worked on my coaching program a little bit. Basically uploaded a call recording for that. I've been trying to teach my mom she just came back from India. So I want to get her more involved in the business and teach her how to start doing some of the stuff, so I can offload some of the tasks that I have onto her. And then I saw some patients this afternoon, so I was doing all that patient care stuff. And then now it's just now it's just time to work. Haven't seen you in a while. Yeah, I know, it's been all of 20 hours since we last went live. Do you use serum tears? I do not use serum. I use them very occasionally, maybe once a day. But I used to use them 4 or 5 times a day. No, I just use artificial teardrops. I've never tried the serum tears. I assume you mean the autologous serum tears. I've never used those before. So yeah, is Vyvanse more effective than Concerta? They're just different. Vyvanse is a amphetamine compound, and then Concerta is a methylphenidate. So they're just different compounds. They're both pretty equal in terms of duration. They're both 10 to 12 hours long. Vyvanse is a little more longer than Concerta, though, slightly. But yeah, it just depends. Some people do well in one versus the other. Does forgetting to eat ever... Oh, whoops, we already lost it. Does forgetting to eat ever revolve on non-stimulant ADHD meds? And which ones does appetite help the most? So all the non-stimulant meds definitely mess up appetite a little bit. They all have an appetite effect, unfortunately. So I would go with the non-stimulants, though, if I'm trying to avoid appetite issues over stimulants. Nice, welcome. What do you propose for insomnia? In terms of medication, I like trazodone. I think it lasts the longest, and it's very flexible too. I mean, sleep hygiene is really good. Having the same bedtime each day, waking up the same bedtime, cutting out caffeine. Caffeine cutout is very solid too. I think people that drink too much caffeine. Not having coffee close to after lunch, that can be a big one. Not eating close to bedtime. Taking a warm shower before bed is also helpful. All of the above. Xiao, welcome. Yeah, do I have a cold? I feel like I always have a cold. I'm allergic to my cat, that's the problem. I haven't seen her for 9 months, and now I've been living with her again. So my allergies it's taking some time to get used to this. I look like your science teacher. Nice. How to not gain weight taking Vraylar. Basically, if you don't want to gain weight on your psych meds, then you have to be a little bit more vigilant. So you need to make sure you only eat high dense foods, high filling foods, lower calorie ones. Don't be munching on chips and snacks. Just get rid of all the junk food in your home. That's been the best advice for me, honestly. It's like if I get rid of all the junk food in my home, that's when things do the best. Literally can't find myself. Honestly can't find my, oops, I already lost it. Literally can't find myself to eat with my recurring OCD thoughts. Yeah, I have a patient I'm treating for OCD right now, and we're doing a little bit of exposure type of work. Basically, I'm encouraging him to give himself exposure to the thoughts, but then not act on the compulsions that come with it. So to not touch the walls everywhere, that type of thing. So I'm giving him exposure therapy for that, and we're also doing sertraline as well too. Can you save your live? I don't think it's able to be saved on Instagram, but on YouTube it does save. So I think I'm going to upload it onto YouTube. Yeah, now I've started triple streaming. So before I was just doing TikTok, and then I went out to TikTok and IG, and now we're doing TikTok, IG, and YouTube. So we're definitely expanding the realm. So I think I'll upload the recording of the live on YouTube. It doesn't really make sense to upload a full live recording on Instagram or TikTok because those are more short form platforms. But if I'm going to do a sit down live, I think I'll do it on my computer. What's the best medication for spotlight anxiety? Propranolol. We use it for something called performance anxiety. So that's what propranolol is used for a lot. Sick athletic Ray-Bans. So these are not athletic Ray-Bans, these are dry eye glasses, believe it or not. Yeah. I'm at peace with my decision. Good. You should be at peace with all your decisions. That's the most important thing. Right? They say that speed is more important than anything. Most people screw up in business because they don't make a decision fast enough, and they just try to think. And by the time they make a decision, the moment has already passed. So like you just have to execute. It's the same thing with romance too, right? Like whether you ask someone on a date or not, whether you go in for a kiss, like you just got to execute and like make a snap decision rather than trying to overthink stuff. So yeah, it's good if you be at peace with the decision. Exactly. With my Prozac, cause burning in my mouth. I keep drinking water. I don't understand. Maybe try it with food. That could make a difference. What's your opinion on Mirtazapine and escitalopram? If I take them for my depression, yeah, those ones, thankfully, are pretty easy to come off of. They're not the hardest. Yeah, thankfully, they're not as hard as something like Paxil. What's a good crossover from Prozac for OCD? What do you mean a good crossover? I'm not sure what that means. How to taper off benzos, 75.75 milligrams? It depends on which one. Clonazepam's the easiest. Xanax is the hardest. I gotta execute, yeah. My Psych just recommended magnesium glycinate for sleep. Yeah, I recommend that for sleep too. Like 200 for 500 milligrams-ish for sleep is usually pretty solid. Is Effexor weight gain? Is there weight gain or loss with Effexor or trazodone? It's probably mild. Effexor is pretty stimulating, so it can reduce appetite, which is helpful. Yeah, hey, what's up? How are you? If irritability is the main complaint of my depression, should I take Wellbutrin? Maybe not, because that can worsen irritability. Space days, I did a mess and went to 9 milligrams the day before. Yeah, you can definitely space them out too, especially if you're trying to taper off something. So you can always go to every other day and then go from there. Precisely. Benzo is Clonazepam, on for a year, on and off a few times, over 20 years. Yeah, luckily that one's a little bit easier to come off of because its half-life is bigger. So that's nice. If Prozac's not working for OCD, what next? I like Zoloft, I like Luvox, or clomipramine. Those might be the better ones. Side effects of Effexor 225. make me feel high 8 days in. Should I taper down? I mean, I don't know your exact condition, but oftentimes you just have to stick with it for a while, and then the side effects go away. Because remember, there's a reason that you increased it too. Why can't I sleep on Seroquel? Maybe the dose isn't high enough. Thanks to you, I got Vyvanse generic. My doctor didn't know. Nice, yeah, generic's definitely a thing, and it was way cheaper. We can't get my mom to go on the go for anything. It's severe stubbornness. Helping a way to go help her. Yeah, you can do what's called motivational interviewing. Look up motivational interviewing, and that could be helpful for her. Basically, you use the technique and you try to build up her own motivation to go. Basically, help her see the reason why she should go. Because if she takes anything, if you're trying to get your loved one to go to the healthcare worker, they're not going to go because you want them to. They're going to go for their own reasons. So you need to implement motivational interviewing to figure out how they can, to increase their motivation. So ask them for their reasons that they would want to go versus not go, and really ask them for all the damage and pain that their current problems causing in their life. Because if you make them talk about their problems and pain enough, then that can be a motivator to go because they realize how crappy their situation is. Hi, can you give us some help? Our son is suffering from OCD. He thinks he's hitting someone when he drives and it's crippling him. Yeah, it's pretty common for the OCD. I would say use a high-dose SSRI. That's what you want to do. And also do exposure therapy. So that is a key as well, too. So high-dose SSRI plus exposure therapy. Yeah, and if you want to get more personal help, then you can look at booking a consult in my bio, and then we can see if we're a good fit to work together. And also, I can advise in more detail for your specific situation. Your content is the best. Thank you. I appreciate that. Morning from New Zealand. Thank you. You give me extra dopamine. Love your face. Appreciate it. I'm on Wellbutrin, but I need the lowest dose of Vyvanse. Nice. Yeah, sometimes you can stack on Vyvanse with Wellbutrin to get a little bit more ADHD kick. My son has been on Prozac for 2 years with no help. Is it time for a change? It depends on the dose. Sometimes the dose is too low, but if it's a high dose, then yeah, it can be worth changing. Sometimes the meds just poop out too. Morning. Definitely not morning here. It's so funny. Why do doctors come in and talk other shit about doctors? We should all be supporting each other. Tell me some of the... Where's my mods at? I need your help. My doctor is all... Yeah, can you... My doctor is all televised now, which is fine, but he spends 2 minutes with me and just refills. I need a new doc. Yeah, see, that's not good. I usually spend 30 minutes on follow-ups and an hour and a half on my initials. So that's the difference, right? I think that's what happens if you don't pick a good person. And sometimes that's why I have a lot of patients who seek me out, because they go outside of insurance to do that. Because if you do an insurance care, then you usually just get the 2 minutes doctor visits. Yeah, if they're on 80 milligrams for 2 years, that's a big dose. So it's probably not doing much for you anymore. That's the max dose. What's your opinion on Buspar for kids? Buspar is decent for an adjunct, but it's not that good on its own for anxiety. So you can use it to add on to something else, and that's decent. Your heart's in the right place. My psych said no to coming off Latuda. It's the OG. Appreciate it. What kind of question would you ask for essing attempt? Need help for my assignments? So you can just ask them directly. Honestly, you don't ever need to be if you're asking about unalive thoughts, you don't need to be what's the word? If you're asking about unalive thoughts, you don't need to beat around the bush. You should just ask straight directly. Advice for being on autopilot, no intermittent law. So you come in, my friend, I see you come in to most lives and you always ask about derealization, right? So it sounds like you're really fixated on it. So I would definitely look at getting some help IRL for this thing, because I wonder if you're doing that versus just like online research. And lives like this can only help you so much. I can tell this is a really big problem for you. So definitely look at investigating this IRL too. And I suspect there's more going on than just derealization. That's not the cause of all the problems that are happening. Can CBD help depression? I'm not really into that stuff, so I don't know. Like, I think it would help anxiety. I don't know about depression, but I know that THC can definitely cause a lot of motivation problems, which can worsen depression. CBD is also helpful for chronic pain. Vraylar gives me ants in my pants, but it helps. Do you mean restlessness? I'm not sure what you mean. Okay. Red color theory. Yeah, restlessness. Yeah, restlessness is a pretty common thing. Unfortunately, it's very common with that med. Yeah, so you can use something called propranolol, which can be helpful. Yeah, it's very good for anxiety. Yeah, there's not much evidence for it for depression that I'm aware of. I'm Punjabi, brother, I'm struggling big time. Then you got to seek out the help. Help doesn't come to you, right? You have to seek it out. Oh, okay, we're back. We're back. What does an industrial psychologist do? I don't know. I do not know. I assume they work with industry like corporations, but I don't know. What medication is best for EUPD? So we call it borderline personality, right? Whereas you call it, but the best medication for that, there's no actual approved medication, but some good ones are Seroquel. Seroquel is really good. Abilify is decent. Lamictal is good. Yeah, there's some options there. Those ones I use a lot for that. Yeah, we call it BPD, but same thing. Buspar plus a stimulant for ADHD because SSRI was not tolerated. Yeah, then you can use it. Like, you can certainly use it and it can help. You probably just won't get as good of a benefit off of Buspar than an SSRI. But if there's only like a mild to moderate anxiety component, then you can definitely use it. Sorry, I missed the question. I don't know if you already answered. How did you survive med school? You just did, you just buckle down and get to work. Once you take out that first loan, you start first year, you're $50K in debt, then you're pretty locked in, there's no going back. So if I quit med school, it's kind of like that analogy where the general takes his army to the ships or to the shore, and then he orders his army to burn the ships because he's like, hey, we're taking the enemy ships or we're dying, we're not going back. So sometimes when you give yourself no other option, then you have to succeed. Yeah, exactly. Those are the glasses, yes. Do I use clonazepam? Very rarely. I don't use it very commonly at all. Is bupropion good for a burnt out, grief, semi-depressed, very anxious med student with SI thoughts? Yeah, actually. Yeah, that fits all of those. It's very energizing, so it'll help with the energy. How did you get dry eyes? I've had it since a kid. I have what's called meibomian gland dysfunction. So my meibomian glands don't fully produce moisture, and they don't fully produce fat, and so my tears evaporate very quickly. So I have to use my meibomian, these glasses, to help protect against that. I don't work with him anymore, so I can't really comment. Do your eyes hurt? No, they don't hurt. These glasses have been a lifesaver. Like literally, these glasses have been a game changer for me. Best vitamins for energy: SAM-E, omega-3s, serotonin, or not serotonin, saffron. Those are all good for energy. Tyrosine for dopamine. Green tea extract. Have I treated patients on the spectrum? Yeah. So I'm a child and adolescent psychiatrist. So I worked with a lot of kids on the spectrum. I take NAC for my OCD. It changed my life. Yeah, it's great. I start NAC with all my OCD patients. How long? 5 years. I graduated residency in 2019. Should I ask my psych for Wellbutrin instead of Vraylar for MDD? No, I mean, it depends. Vraylar is less stimulating. Wellbutrin is way more stimulating. So it's hard to say. I don't know your condition. Thoughts on Uvality versus Wellbutrin? I mean, I would try Wellbutrin first, and then look at Uvality just because it's cheaper. I don't use that medication. No, that's probably a European one. We don't use that in America. I get super anxious during exams. Oops. RIP. Please save live on YouTube. Yes, of course. Yeah, I'll save it live on YouTube. Yeah. But vitamins, basically, omega-3 is good for energy. L-tyrosine, saffron, green tea extract, SAM-E. Do they teach you about withdrawal? Yes, yeah, of course. Yeah, withdrawal is definitely a thing. So that's why you got to taper off meds slowly. Thoughts on Ehlers-Danlos being correlated with PMDD, ADHD, and ASD? Ehlers-Danlos is much less common than all of those. Are you Gen Z or young millennial? I am a Gen Z. No, sorry, I'm a millennial. I'm not a Gen Z. No. Latuda does not make you manic. It helps treat bipolar, specifically bipolar depression. Have you seen any improvement with OCD without the use of medications for only supplements and ERP therapy? Yeah, you can. It's helpful for mild OCD, but severe, it's not enough. What mental health sections do you have in America? I'm not sure. What do you mean sections? Like we have involuntary hospitalization. Hi from Malaysia. Move the camera lower. No, this is not that kind of stream. Thoughts on Lamictal for bipolar? It's helpful for bipolar depression, but not really for mania. What does it mean if buspirone and duloxetine make your chest tight and uncomfortable? What does it mean? Well, it means that maybe that's actually a thing. One of my patients told me that they took Luvox, and the Luvox caused them to have chest pain. So I definitely believe it. So it probably just means that you have to lower the dose a bit. It can be a side effect. What medication would you prescribe for excess adrenergic activity / muscle hyper? You know what? Just for you, I'm going to move the camera even higher. What would you prescribe for excess adrenergic activity? Guanfacine or clonidine? How can you talk and walk like that? Oh, my throat hurts. But it's okay, we push on. Let's see, I don't know what my heart rate is. This is a slow walk, like this is not a fast walk by any means. Like my heart rate, this says it's 71, so it's not a big heart rate. No, rip, yeah. How long can you keep involuntary patients? So normally you do a 72 hour hold, but then once you do the 72-hour hold, then you have to file a petition to keep them longer if they're at a danger for themselves, which a lot of people definitely are. What meds would you recommend for extreme stress during exams? Probably propranolol, to be honest. We use that for performance anxiety, so that's the thing that I would recommend it for. What medication for anxiety, depression, but also helps with weight loss? Effexor is probably one of your SNRIs are probably a go-to, probably Effexor. Prozac is pretty low for weight gain as well too. Bupropion, Wellbutrin helps with depression, but it doesn't help with the anxiety. My psych took me off propranolol because I have asthma. Oh yeah, that can definitely be it depends on how severe the asthma is. For mild, it may not be a big deal. Thank you, you're welcome. Treatment for agoraphobia / panic disorder. Would you recommend CBT treatment prior to medication use? Yeah, if you're down to do it, definitely. Usually you get the best results from combining treatments rather than one or the other. And it also just depends on how severe it is too. Like I have a patient who, she has agoraphobia and her leaving the house is really hard, and she's in exposure therapy, but she finds the exposure therapy really hard to do. So it's really hard for her to do the exposure therapy. So that's why she's on medication, because she wants to decrease how intense her sensations are. Do you find propranolol to cause unopposed alpha activation? Only at high doses, but at low doses, no. Yeah, also, are you a provider? That's a very technical question. Do you recommend supplement anxiety, magnesium? I would definitely say magnesium. L-theanine. Those are two solid ones. Magnesium and L-theanine. Thank you, appreciate that. Can limerence be a part of OCD? I'm not sure what limerence is. Don't take supplements if you take meds without checking if they interact. Yeah, most supplements are pretty decent, they don't interact and stuff, but some definitely do. St. John's wort definitely interacts with stuff, so you don't want to be taking that willy-nilly. And some of them can cause increased bleeding, so you just want to be mindful of that one as well. If you become manic from taking antidepressants, does that mean you have bipolar? Usually it does, yeah. But you have to become a true manic. Manic doesn't mean that you just get a little bit of energy. Does propranolol contradict with mirtazapine and escitalopram? No, they work pretty well together. They tend to be a good fit together. What color should I do my nails? What color should I do my nails? I don't know. Pink. How old am I? Chat. How old are we? Lexapro has eliminated my anxiety, but I'm always very tired now. Maybe take it at nighttime, or you could also split the dosage too. Sometimes I find splitting the dose can help. Can SNRI and SSRIs exacerbate sleep apnea issues? Yes. Yeah, they can. Especially SNRI can make you like stay awake for longer. So if you can get some more sleep, if you can get the sleep apnea treated with like your CPAP, that can be helpful. It helps relax. Can you take Zoloft when needed? No. You don't want to take Zoloft only as needed. It's more of a daily med. Okay, I need some water. $30, $31. Must be 30s because of schooling. Yes. Yeah, I'm 31. 35, wow. Yeah, I usually get like 25. Set this water down. Oh, rip. I accidentally pulled the stop thing. How's 31? I turned 31 in June. Nice, I turned 32 in June. Why? Because SSRIs take time to build up, so they don't work like immediately. That's different than something like Xanax, which tends to work more immediately. So that one you would want something like Xanax or Clonazepam you can do as needed, but Zoloft you definitely want to do more daily. What kind of car? I don't drive a car. Well, I live in New York, so I don't drive a car. But I used to drive a Subaru when I lived in Michigan. I first started out with a Toyota Scion, and then I switched from a Scion to a Subaru, and then I just never looked back. And then then I sold when I moved to the city, Manhattan. Then I sold my Subaru. What setting do you work? I work remote. I do all. I work from home. All telehealth, all private practice. It makes me sleep big time. Okay, yeah, that's why I would still take it at nighttime. But just, it was more of a daily thing. Is 5 milligrams of Lexapro a good maintenance dose? Yeah, it can be. It just depends on the patient. Do you want to precept me? So, I can't precept you. However, I have created a new nurse practitioner coaching program. So if you want to learn from me, then check out my bio. That link is in my bio for that. Yeah, welcome Kareem. Are you on meds? I am not. Well, I take hair loss meds, but no psych meds. Do I allow virtual shadowing for pre-meds? I do not, no. Unfortunately, just because my patient population is more private, yeah. I would look at shadowing in your immediate area too. Because if you're a pre-med, you want to get a good letter of recommendation. Does Wellbutrin make you cranky? It can for some people. Why does duloxetine make my nerves fire? I have an old elbow injury. It's actually supposed to help with nerve pain. That's the whole reason duloxetine is prescribed, to help with nerve pain and chronic pain. So I think that's what you're experiencing. I just started bupropion and have heart palpitations. Yeah, that's pretty common actually. That's very common. The heart palpitations with bupropion. Do I recommend psych trials at Yale? I don't know. I've never had any affiliation with them, and I don't know what that is, so I can't really say anything about them. How long will it be on the treadmill? As long as I feel. Maybe like an hour, 30 minutes. I don't know. Are you Iranian? No, I'm Indian. Why are some people so against Effexor? It saved my life. Because it tends to have withdrawal. That's the only thing. Like the withdrawal can be bad. But if it really helps, I think it's a good medication. I think it's really powerful. I think it helps a lot. How do you decide between beta blocker or clonidine and guanfacine for overactive SNS? Basically, if I want them to be sedated or not, or what kind of mechanism I want, because they have different mechanisms. But both can work. Yeah, both can work. If I don't want to take drugs but I'm having a lot of psychogenic symptoms, what do you recommend doing? Probably yoga or mindfulness. Those would be the top two. Yeah, probably yoga or mindfulness. That's what I would do. Can you explain complex PTSD? Yeah, basically it's like PTSD that builds up over time. That's what complex PTSD is. Or it's like you have multiple things, or you have multiple traumas, not just like one trauma. Also, in my country, gets icy. Grandpa was sliding down all fours, screaming. Okay. Best medication for panic disorder. High dose SSRIs usually are what you want to start with. What do you recommend, SSRI or SNRI for GAD? Start with an SSRI first and then go to SNRI afterward if it doesn't work. Sometimes the norepinephrine from an SNRI can be a little too stimulating, which doesn't work. Does gabapentin help with sleep? Yeah, it's pretty sedating, so you can use it for sleep. There's no meds to get over a toxic love, unfortunately. You just you gotta level up to get over a breakup. Starting ECT. Memory loss can happen, but usually it's temporary and it's transient. So it tends to go away, and it's within the first, it's usually just like either right before the ECT or right after. It's not like you forget who you are and things like that. How long does Concerta take? Like 4 weeks. I need to fire the other mods so you can have mod domination. Maybe you should make you a super mod or something. It's definitely not a recommended med. Why can't a mental health therapist help friends and family? They can. It just depends on the therapist. They can. Like, I help my friends and family. Not like officially, but like just unofficially, yeah. I feel like if I have a skill to help them, then I'll help them. Just like if I was a realtor and I have friends and families who wanted real estate advice, if I was a gym, like a personal trainer, and my friends wanted fitness advice, like I would give it to them. Is gabapentin good for body aches? Yeah, it's really good for pain body aches. Yeah, that's what more it's used for. Like nerve pain, chronic pain, that type of thing. Yeah, it's pretty safe for heart patient. How fast to get a consultation? Yeah, so you can book a consultation in my bio, and my assistant will go through it. So, like, probably we could do it tomorrow or the day after. So it's pretty quick. She's very efficient. What's the best med for schizophrenia? Antipsychotic. Antipsychotic is the best med for schizophrenia, but the one that you want to use just depends. It feels more one-on-one. I like it here. Yeah, the world is quiet here. Bonus points if you know where that reference is from. Can gabapentin cause SI? Not really. It's not really known for that. SSRIs are known for that, but at a younger dose, or at a lower dose, sorry. Or no, as for in a younger age. I have tight hips and buspirone makes them relax. Yeah, it's probably the serotonin. Serotonin probably just helps relaxation in general. Does schizop ever go away? Schizophrenia, you mean? Usually it doesn't really go away, it just gets managed. What's good for phobias? Driving, highways at night. I have a mold, agoraphobia. You can use SSRIs. You can use something like propranolol to help with the physical agitation. And you can use exposure therapy. That's very helpful too. So usually a combination is the best. Ashwagandha gummies. I've never used the gummies before. I've only used the capsules because it's an herb, right? So I don't know how it would be in gummy form. What do I think about memory loss and gabapentin? I wake up lost. Lost where? Lost physically? But it can happen. Yeah, gabapentin can be very sedating and just it causes people to feel loopy. Also with the gummies, you have to be careful because a lot of them are low dose. A lot of gummies are low dose and they'll trick you. What's the lowest dose for gabapentin? 100 milligrams. Yeah, but yeah, the gummies, I probably wouldn't recommend because most of the capsule isn't active ingredient, it's just gelatin. Best med for psych-induced restless legs, propranolol. Or iron, check iron too. Can you prescribe me Ozempic? Do you really want Ozempic? That's the question. Ozempic also causes muscle wasting too, so you got to be wary of that. Yeah. That's why I always just tell people to get the capsules. You'll notice the dose is way lower on the gummies, and that's how they trick you. The strongest ADHD stimulant? They're all pretty strong, to be honest. Probably an immediate release like Adderall. I need the summer bod archive. Yes. Yeah. Just go on a calorie deficit. That's the best way. You don't want to lose your muscles too. You don't want to lose your biceps. Just go on a calorie deficit. Go on these walking lives, and the summer bod will be ready in no time. Should I drop Wellbutrin since I'm taking Vyvanse 30? Wellbutrin's also used for depression too, not just for anxiety, or not just for ADHD. Let me see your biceps, please, Zaddy. That's you have to come back for the sub-only live for that one. What is the best med for panic attacks? Probably high-dose SSRI. Also, you can use an Ativan or something in some situations. Yeah, so I definitely look at also subscribing or subbing as well, because if you sub, then your questions stand out more than anyone else's, right? So you see that there's 74 people here, so it helps to stand out your questions over everyone else's. Sub only live for that. Got to do the thirst traps, That's what the people are wanting. I'm just trying to live life here. Is bupropion effective for anxiety? With schizo effective? No. Yeah, it's not effective for any of those. It's more for ADHD. Your videos are helpful. Thank you. Yeah, a lot of my recent videos are from my NP coaching program, actually. So they're all Q&As from our coaching calls. What helps with PTSD from an explosive while actively still in the military? EMDR can help with that. SSRIs can also help. Guanfacine and clonidine can help. Basically, you want to calm down the affectivity. Yeah. You want to calm down what we call affectivity. That's the most important thing that we want to do. How can I join the Q&A? So the best way to join, so if you're a nurse practitioner or a PA, then check out the link in my bio, and that's where my coaching program is. So that's where you want to join it. And we've had 55 members join in the past 3 weeks. So demand is definitely there, it's growing. And so if you want to learn from me directly, right, and ask questions and discuss cases, that's the place to do it. Are you not in NYC? No, I still live in New York. I'm just at my parents' house in Michigan right now because I really wanted to focus on this coaching program. So I went there for a month. I'm going to be here for a month to just focus on growing my coaching program and growing my practice. And then I'm going to go back because New York just has a bunch of distractions. The worst days of Lexapro are 7 to 10. Yeah, the worst days are definitely the first 3 weeks, I would say. It gets better after the first couple of weeks. If SNRIs, buspirone, help my anxiety, does this rule out ADHD? No, you can have both. You can definitely have both anxiety and ADHD. How well does Caplyta work to prevent delusions? It works decently. It's an antipsychotic, so it's an antipsychotic with some mood benefits, so it works well. What to do for sweating with Lexapro? You can take propranolol. Also just make yourself cool. Try to just stay cool as much as you can. Stay hydrated as well. Usually a lot of the side effects go on within the first couple weeks. So yeah, just try to manage it as best as you can, power through. Hydroxyzine, why does it make me feel like a zombie? Should I take half? Yeah, hydroxyzine can make people feel very sedated and tired. So, how does one stop weight gain? By really being cognizant of your diet. Because ultimately, psych meds can increase the weight gain. They can make it easier to gain weight and they can reduce your metabolism. However, ultimately, you still put the food in your mouth. So, you want to control the environment to make it easy for you. Which means that get rid of junk food in your home. Eat whole, low calorie, high filling foods, vegetables, and lean proteins. That way you stay filled up, but it's low calorie. Don't get a bunch of snacks like chips and cookies and carbs and stuff. Cut out carbs, simple carbs like rice and sugars and stuff and muffins and bagels and things. Because those are pretty much just empty calories. If SSRIs can help PTSD and it makes you manic, then probably mood stabilizers or antipsychotics would be a better fit, something like Seroquel. I used to use Seroquel a lot for my PTSD patients at the VA. Can you use hydroxyzine for acute anxiety? Yes, you can. What if antipsychotics induce severe psychotic episodes? Same with alpha-2 agonists. That's where, when you get into nuanced situations like that, there's no way I can actually answer them. So, that's where booking a consult will really help you. Because otherwise, this won't really help, That's why people seek us out, is for our expertise, right? Because anyone can answer simple questions, like a PCP can answer simple ones, but then when you get to complex situations, that's where a psychiatrist really makes a difference. And knowing your individual situation makes helps. What do I think of Lamictal? It's good. I like it a lot. I use it for bipolar depression. That's the main thing that I use it for. What are your thoughts on stimulants while pregnant? For ADHD, it's not ideal, but if you have to do it, you have to do it, you know? So, yeah. Why does my stomach hurt all the time? Like something is squeezing it? I don't know. There's no way to tell without further information. How do you know if I have depersonalization or fight, flight, or freeze mode? I think they're the same thing. I mean, that is a kind of a trauma response there. Best personalities for people with multi-personality disorder. I mean, I think most people it's not actually a real thing, but if it is, then you definitely want some mood stabilizing antipsychotic treatment to make sure you're grounded in the present. But a lot of people say they have it when they don't actually have it. Any new blockbuster anxiety meds on the horizon? No. There's not much, I don't think there's any kind of blockbuster treatments in psychiatry. If there were, then everyone would know them. Stimulants are often not needed for safety. Could it be IBS, amygdala? Thoughts on pandas? Yeah, it's definitely a real thing. Pandas is 100% a real thing. So, yeah. I've had multiple patients who've had this. So it's definitely a thing. Why do you need a gastric psyche for a gastric sleeve? Because gastric sleeve is a serious procedure, and the worst thing is to do it in someone, and then they immediately just blow up and wait again. So you want to make sure there's no underlying psych condition like an eating disorder or something. That's what you would want to avoid. Any conditions you don't treat virtually? Yeah, like schizophrenia. I mean, severe conditions like severe bipolar mania. I wouldn't treat an ED virtually as well, too. What is the lightest antidepressant? I'm not sure what you mean by lightest. I think Lexapro tends to be the least, tends to have some of the least side effects. So that's pretty nice. Oh, what is my cat doing?